Let me tell you what I have learned about drinking water and the issues around drinking water in Maine and what it is I figured out we could do because I already had a, water quality testing infrastructure in place in my lab and the ability to help people collect water and understand information about water. So it wasn't a big leap to drinking water and helping people with drinking water issues. So I'll share my presentation, give you a little background, and then I think there'll be plenty of time for questions. My current version of this talk is understanding the effects of contaminant exposure as we age. Community engaged research with Maine Islanders. So community engaged research means that we in our community environmental health laboratory at MDI Biolab in Salisbury Cove, Maine, we are open to uh, helping you research the questions that you have. It's not all about what is the research program I'm doing that you can all get involved in and contribute to, but we are very open to listening to what concerns you all have and perhaps as we can take our research in a direction. That's what community engaged research is taking it into the direction that has meaning for you. But let me tell you where we're starting from and what we're doing right now. I've been collaborating with Tom Muser, who is at the Center for Excellence in Aging and Health at University of New England. He's been working with older Mainers for quite a bit of time, helping them assess their health and well-being as they age, and so has been collecting a lot of interesting data. And however, as we've gone along, we've come to understand that that exposure to contaminants is something that's happening over a lifetime, and that it's never too early to start looking at the effects of environmental exposures on your health. And then if we can get a handle on some information as time goes by, we'll understand like where are some crucial points that we definitely need to be making a difference. So arsenic, in case you haven't picked up on what our big concern is, it's arsenic. And that's because look at up here in New England and in Maine in particular, this is the probability that your arsenic will be greater than 10 micrograms per liter, which is also parts per billion, you'll hear me say. And that is the EPA maximum contaminant level for public drinking water. There really aren't regulations on your private well water, but if this is the standard for everyone's public drinking water, it's the standard we might want to consider as we think about our own private drinking water. So I'll tell you a little bit more about why is the probability so high up here in Maine and New Hampshire that we're going to have a lot of arsenic in our drinking water. My next slide, actually, I just threw in some slides from the Maine Tracking Network, taking a look at wells that exceed state guidelines. And I tried to pull up some of the islands, and what I noticed was that some of the islands don't have high arsenic in terms of what samples there are to look at in the state database. Some are pretty high, like 29% of wells on Mantinicus. And then others, like there's no information, like there's no data in the state data portal. So this is getting me thinking that we need to get some information for people knowing that the risk is high. And there was a study done by the USGS back in 2010, 2009, 2010. And I was able to glean a little bit of information about how many people on islands are reliant on private wells. And it turns out it's like most people, and I have to imagine those that aren't are just bringing their own fresh water to the island. I don't know. I mean, unless they've got a spring, and so it's not being defined as a well. But I think for the most part, people on islands are dependent on private water sources, and these are unregulated. So there's no one to tell you that you have to test your well or that you have to deal with contaminants in your well. But I hope that after tonight, I can convince you that it's worth taking a look at and considering what your alternatives are if you do have any of these contaminants in your well water. So for example, up here, we can see that like, at least in 2008, there were like 54 households. Or let me see, is that a percentage? It's the actual number of households, say on the Cranberry Isles, reliant on private water. But then you can see down here that only 12 of them had tested their water as of this report. And I know this is old, but I can't find any recent evidence that there's a lot more data out of the Cranberry Isles on wells. And then there's a brand new update to the main tracking network, and it actually looks like fewer wells have been sampled. So I don't think the data is going back that far. So I'm actually going to talk to CDC, Center for Disease Control, in the Department of Health and Human Services that really runs this data portal to find out what are the actual numbers. But, even if somebody had their well tested back in 2008, that's too long ago. I mean, you have to do it every so often because things change underground, and you can have contaminants tomorrow that you didn't have today. That's one of the things we've been learning in our studies. Okay, so let's see. Whoops. There's a recent paper that came out, a scientific article about, it was like this machine learning paper that took all kinds of information about the probability that wells would have high arsenic based on a whole bunch of things like the underlying bedrock and aquifers and how water is flowing. And what it looked to me like is that there weren't many islands that had really high probability of arsenic. But then look, Matinicus down here, which is light yellow, which is the bottom of the spectrum here, doesn't seem to have a high probability of arsenic over 5 parts per billion. But I showed you earlier that actually 29% of wells in Matinicus have high arsenic. So I don't know that these national level analyses are capturing what's really happening out on some of the islands. So I don't know that we can rely on these kinds of things and say, well, Vinyl Haven looks pretty good. We don't need to test out there. I mean, I think the fact that we already know Matinicus has a lot of wells that are high in arsenic means that whatever machine learning model was used to generate this kind of a map, it's called a heat map, that it was missing some variables that were important on this island and could be missing some things important on other islands. So it's all worth taking a look at. Okay, so maybe this should have been my second slide to tell you about metasedimentary rocks, because the high arsenic in groundwater tends to naturally occur from our underlying bedrock. Just by virtue of how elements got distributed as rocks formed over millennia, we have a lot of arsenic in the metasedimentary rock underneath our, land that we live on. And this is what we're tapping into with drilled wells, with driven wells, sometimes even dug wells, right? And this is really driving the arsenic issue in private water in Maine and New Hampshire. Ellsworth schist, this kind of rock, you may see it out on your islands. This is Bar Harbor looking out toward Bar Island, and This rock is metasedimentary and it is high in arsenic. Now, arsenic can come from other places. In truth, it's in a lot of foods we eat. And so, in particular, rice, and even more so brown rice, has arsenic. And some other foods that we eat that may have been harvested from areas with high arsenic in the soil. So there's even people I know that would suggest that you limit your consumption of brown rice, that it's not something you have every night of the week, because it does tend to have arsenic in it. So the fact that we are getting arsenic from some of our food sources means that maybe we don't want to add to it through our drinking water, and maybe expose ourselves to even more arsenic than we think we are. Now, metasedimentary rock is probably driving most of the high arsenic in Maine and New Hampshire, but the truth is we do have a long history of using arsenical pesticides on potato crops up in Aroostook County, on blueberry fields, in apple orchards. And so there is arsenic that you can detect in soils in some of these areas. The degree to which some of this is percolating down into the water table and affecting our wells, I'm not sure. I have the sense from some of the data we've been collecting that it does impact dug wells. So I have seen people with shallow dug wells that have high arsenic, and these are in areas without metasedimentary rock, like around the Waterville area in particular. So where is the high arsenic coming from? It could be from this use of arsenical pesticides. The thing about arsenic is you really can't tell by an analysis whether it was from historic use of pesticides or from the metasedimentary rock. It's not always easy to say. But when I see it in an area where I'm not expecting it, it does have us then looking at soils in orchards and gardens, and we have found some interesting things. But that's a story for another day. Why is arsenic a concern? I mean, I think everyone probably gets it, that it's toxic, right? But it causes specific diseases even when the exposure is fairly low, if the exposure is over long periods of time, hence my interest in the effect on the aging process. So there's a really well documented study done right here in New England. It was Maine, New Hampshire, and Vermont. And the elevated bladder cancer rate was 20% higher in these states than in other states. And after an analysis, it was shown to be directly attributable to exposure to arsenic over lifetimes. So we know that bladder cancer is an issue in New England, and it's probably related to arsenic exposure. Maine, I mean, on the islands, you may have 100% reliant on private water, but throughout Maine, it's pretty high reliance as well. 56% of people in Maine rely on private wells. And then there was a really interesting study done right around the Augusta area, 3 different school districts, where Columbia University came in and did a cross-sectional study of well water arsenic and childhood IQ. And they found that in households where children were exposed to even 5 parts per billion arsenic over their short lifetimes, like I think they were looking at 7, 8, 9-year-olds in this study, they had statistically significant lower IQs than other children who hadn't been exposed to these levels of arsenic. So this isn't the only study on childhood IQ or childhood development after exposure to arsenic. So we definitely don't want our kids drinking even low levels of arsenic throughout their early years, because we know this can have effect on brain development. So those were just a couple of examples, but I could go on and on with the fact that it's arsenic exposure is linked to diabetes in pregnant women, that it causes changes to the body's hormones. It alters our immune systems, which is probably why it predisposes us to some cancers, because your immune system needs to always be fighting cancer cells that pop up in your body. But if you have a depressed immune system, then you can't do that. So, and there's cardiovascular problems. This has also been part of my interest in the effect of arsenic on aging, is that there's a lot of diseases of aging, which we might attribute just to the passage of time. Well, we're getting older, our cholesterol is going up, we're getting older, we're having cardiovascular problems, we're getting older, we're more susceptible to the flu. I mean, there's enough of that going on as there is, without us sort of exacerbating that through lifetime exposures to these toxic metals that are naturally occurring in the main groundwater. So to address this, really, I started this whole project as an education effort. And for the past 5 years, I've had this Science Education Partnership Award from the NIH, and I've been engaging kids and teachers across all of Maine and New Hampshire in collecting their well water samples for arsenic and other toxic metals. And we have generated a huge data set. We've initiated a lot of family discussions. Through surveys, we know there's a lot of mitigation going on. People are putting in filtration systems or switching to pitcher filters or bottled water. And then there's been some recent legislative action that students have weighed in on and feel good about how things turned out. For example, there's new legislation that students really advocated for that provides mitigation of arsenic and other contaminants in well water. It provides funds for that. So these are the kinds of outcomes of our project that I think can translate to other projects as well. So yeah, we've had 32 schools, over 5,000 students involved in the project. Students have found that there were a lot of towns that didn't have many water samples. In some case, they've doubled and tripled the number of wells that have gotten tested in those towns. And students have found higher maximum contaminant levels than had ever been reported before in all these towns with the hatch marks, right? So this kind of crowdsourcing data, getting lots of people to test their wells and contribute to a common database, has allowed us, and the Center for Disease Control in Maine and the Department of Environmental Services in New Hampshire, to get like a broader view of what's going on in some of these towns. And then some other interesting outcomes were that our students found really high arsenic levels, like these dots that are above the red lines here. These are all high arsenic levels, above maximum contaminant levels. And look, some of those high arsenic levels are in households that had filters. So either these filters were not the right kind of filters that take out arsenic, or they were whole household filters that weren't functioning correctly. But all of this is information gained by families so that they could make better decisions. So, yeah, here's an example of our students taking action. We've got students in New Hampshire that routinely report to their select board, and then students down in Westbrook, Maine, who were part of that testimony to get that legislation passed that I told you about, that provides grants for eligible owners of single family households or landlords with contaminated private water to get filtration systems installed. And as I said, we had a survey of all, not all, but we had a sample of some of our parents whose children were involved in the programming, and we learned that families were installing treatment systems or upgrading them or verifying that their existing treatment systems were working, encourage families to continue using bottled water if they were already using it, or to switch to bottled water if necessary. And then families requesting follow-up tests or soliciting treatment system quotes so that they could deal with the arsenic that we found in these wells. So after all of this work in schools, I ran into Tom User, who I mentioned at the beginning of the talk, who's the director of this Center for Excellence in Aging and Health. And he was already working with like 650 older Mainers on a health and well-being study. And he said, what if we could get all of these people to test their wells? And I said, I mean, that would be amazing. And it wouldn't be that difficult to do because we already had a method that we'd worked out with the kids and teachers on how to get the water sampled, get it shipped. We work with Dartmouth College. They have a trace element analysis core there that does all the analysis for us, and we get a good rate on it. Like we spend about $16 getting 14 different metals analyzed. It would be like almost impossibly expensive for a homeowner to have that done, and a lot of commercial labs don't even test for 14 different kinds of metals. So so I was like, let's see if we could give this a try. This this program that Tom User runs is called the Legacy Scholars Program. And it's a longitudinal study of healthful aging. So he goes back to these people year after year and keeps asking the same questions, so you can see if there's a point in time where health seems to decline and what are the factors that might be involved in that. And he's created this huge data resource for students at University of New England and for other researchers to study. And so that's where we started thinking about what we're now calling healthy water, healthy aging. That's my new project that we're launching here and inviting you to participate in. So here's some of the medical conditions that they follow over time in the Legacy Scholars, in addition to a whole bunch of other well-being metrics that they ask about. These are just self-reported health metrics. These aren't things that are tested for in this program. These are just things people would self-report in an annual survey. And so one of the things that Tom began to learn about his cohort of older Mainers was that they were actually pretty healthy, and that most of them reported eating a well-balanced diet and attending to their health needs, and they were sleeping well. We see 72% people saying they're sleeping well. I mean, even I don't sleep well, so you know, not so many with high cholesterol or urinary incontinence, for example, not so many with osteoporosis or gum disease. Fairly good findings in this cohort that he's working with. And so we took the location of these Legacy Scholars and we put them on a map that shows sort of the intersection of where arsenic is high around the state of Maine. And I don't have a lot of specific detail on the islands, but you can see that it tends to be light blue out here and not deep purple, which would indicate both high arsenic and high bladder cancer rates. So I'm not seeing that on the outer islands. There's probably some details we might be missing at this scale. But one of the things I noticed too is that this whole cohort of people that we were working with, the Legacy Scholars, they tend to be centered around University of New England. They tend to be centered down here in southern Maine. And I don't have a lot of information in these other areas of Maine, which is another reason I decided to get involved in the project and try to get more people involved. Oh, we'd made similar maps looking at cardiovascular disease and looking at high cholesterol. We're seeing that there's just areas where arsenic and these kinds of health metrics are intersecting, but we don't have people involved in that Legacy Scholars study. So I've put together a team and invited Annie Hohen from Dartmouth College, who is an epidemiologist, to work with Tom and with me in launching this healthy water, healthy aging study where we try to diversify beyond the legacy scholars cohort and try to reach people across the state of Maine, and more particularly in areas where we know we've got high arsenic and areas where we have information on cardiovascular disease or bladder cancer rates, and try to make sure that we get those people involved in our study and get their wells tested. Like I said, I don't think that the testing rate is really high out on the islands, so I think there's not a lot of data there to really understand what the risk might be to people. And number two, I think you saw from that slide I showed where Matinicus looked like it didn't have the kind of bedrock that you would predict would give you high arsenic, but we know 29% of the wells out there are high in arsenic. So there could be other confounding factors, like potentially there was use of arsenical pesticides in on some of the islands where there's apple orchards, or there was some other early agriculture going on. So these are things we can all get involved in looking at. Here's the aims of a study that Tom and Ann and I are proposing. One, we want to assess the extent of arsenic and other toxic metal exposures across the lifespan, and we just by distributing a survey of about drinking water to Mainers and collecting water samples. That's what I'm going to invite you to do tonight, is just participate in a survey about your wells. That part's anonymous, actually. If you decide you don't want to request a test kit, you don't have to, but if you decide to request a test kit, then I need to know who you are. But we're going to do a drinking water survey and test the well water. If you're ready to get involved. Number two, just because you have arsenic in your well water doesn't mean you have arsenic in you. It really depends on how much you drink, and also what else you are eating that might contribute. And so the best way to know people's arsenic exposure is to take a biospecimen. And interestingly, it's very easy to look for arsenic in toenails or hair. And so we hope to collect toenail samples from people who want to go one step further and let us know what their actual exposure is. Because then at level 3, we're going to invite people to be involved in a health and well-being survey, much like legacy scholars, so that we can see if there's any associations between people's arsenic levels and their self-reported. This is the thing that's hasn't been really done before, is whether or not self-reported health metrics can be associated with actual exposures to arsenic and other toxic metals. But this takes people being interested in going through the steps of taking a water survey, so we understand everything about how much you drink every day and cook with the water, right? That's important, in addition to what's in your water. And then what's in you helps us to, more exactly know the correlation or the connection between your exposure and your health. So I have looked around in the literature. I've tried to find out, like, how much do we know about arsenic exposure and its effects over time? And I found 3 interesting studies on neuropsychological functioning and metal exposures, or like cognitive ability in older adults in America and in Native American communities. And so this is a start to understanding what these lifetime exposures might exacerbate or cause problems with over time. But I haven't even found the studies that really are looking at cholesterol or other metabolic syndrome issues or cardiovascular problems with these exposures over time. And in part, I think these are just really difficult studies to do. And that's why I'm wondering, would it simplify everything if we could start amassing a database in Maine, a state where we know people live in their homes a long time. And when we ask them, we see that people plan to continue living in their homes a long time. And 56% of these people are on private water, and quite a few of them have elevated metals because of this metasedimentary rock in the in the landscape. So we have piloted this drinking water study with those legacy scholars. So you can see that I'm reaching like a very specific population of people, and I want to expand from there. We, even among this cohort, we're seeing that people are spending a lot of years in their homes and plan to. Like most people plan to spend another 10 years in their home. So another reason, if if you've been in your home a long time and you plan to stay in your home for an even longer time, I mean, it's never too late to get the arsenic out of your water, because the one nice thing about arsenic is it passes right through you. So it doesn't accumulate in your organs. It doesn't accumulate in your fatty tissues. And that's why I think bladder cancer is one of the bigger problems with arsenic, is because it's one of those places where it sits for a while. And so when you get it out of your water, it gets out of your body, and your exposure's over, which is good. So far, I've had a lot of people submitting city water samples down in that Portland area. Fewer people in that area are really on wells. I do hear that people are concerned about things beyond arsenic, especially this PFAS issue, which is one I'm willing to keep talking to people about. And actually, we've initiated a few PFAS studies in areas of concern. So that's when I talked about community engaged research earlier. We are open to talking about what are the other things you're concerned about. We only have the most preliminary data that I cannot draw a lot of conclusions.
Oh, so this isn't just for Monhegan?
No. So I have some very preliminary data where we've taken a lot of these health metrics that we've assessed from the legacy scholars cohort, where we've tried to assess whether these people have stable health, like nothing has changed for them over years, or declining health because things seem to be changing over time. And we're trying to look at the relationship with arsenic in the water. But this is all grain of salt, because we don't know what's in these people. We only know what's in their water. And interestingly, manganese, of all the 14 metals, manganese seemed to have a shift as self-reported health was declining. And then interestingly, iron, which doesn't surprise me so much, because arsenic and iron often co-occur in metasedimentary rock. So this is not data to go talking to the newspapers about. I just wanted to show you, these are the kinds of things we hope to be able to look at in the future, these relationships between inflammatory states and non-inflammatory states, or stable health or declining health. And then I would rather be making these associations with arsenic in toenail samples as opposed to just water samples. Because again, just because you have it in your water, that doesn't mean you have a lot in your body, because it depends on whether you drink a lot of water. I mean, some people might have high arsenic in their water, but for the most part, they drink iced tea, bottled iced tea, or, they're drinking bottled water. They're not really drinking their water. So these are the things we would assess. So here's what I'm doing. I'm trying to increase the participation. I have a wonderful Island Fellow, Morgan Carnes. Some of you might have met her already, but she's with us for 2 years. She just started. So we have the capacity over 2 years with an Island Fellow to help all of you in any way we can to get your water samples or your toenail samples and get them to us and to get data back to you and to have community conversations about what does it mean, what do we need help with, where do we want to go. We want to engage you in project design. It's starting to pour rain so hard outside my window that that's the sound you're hearing. If it's it's like a torrential downpour right now right here. So we have a big data set. I think that over like the next 5 years, we could reach enough people that we can begin to really draw some conclusions about people's self-reported health and their water. I hope this would help to drive state level decisions about the kinds of support people really need to have safe and healthy water. That's where I'm going with this. Well, we need to be able to share our outcomes and what we're learning and our increased understanding to make the compelling case that what is currently being done to either support or encourage water testing isn't enough. For example, the basic water test that you probably all had to do at some point on your wells, and you were told your water was fine, it probably didn't include an arsenic test. It was probably a bacteria test at best. In New Hampshire, people have gotten very concerned about arsenic in well water and the relationship to health, and they've lowered their standard from 10 parts per billion to 5. So 10 is not low enough for them. And now if you get a basic water test in New Hampshire, it includes arsenic, whereas Maine doesn't. So you can see that it might take more numbers, more people aware, more advocacy to get Maine in line with other states that are really taking the arsenic issue seriously. I think then we can amplify the public health impact. I don't know that we'll ever be able to say, oh, our bladder cancer rates are going down because of this program, but we can hope. And also, I'm open to this conversation about PFAS contamination. I know Chebeague Island is one that's found PFAS in the school, and I don't know what the ramification for that is for households that are surrounding that school. But that's another conversation we can have. So here's our website. It's called allaboutarsenic.org. And you'll see my student program on there. You'll see my Aroostook County program where we're looking at soils and crops. And then you'll see Healthy Water, Healthy Aging. It's right up front for you. And when you click on Get Started, it'll take you to a page that tells you a little bit about all of us who are involved. That's me and Tom. And I have a new program coordinator, Dana Mastriani, who just started. You actually can get to a PFAS page and get a little more information on what we're finding there. And then you'll see specific steps for being involved. First step, you'll just click and take our survey and request a test kit. And then I think Morgan Carnes, our Island Fellow, is going to be distributing kits to the island so you can pick them up somewhere. Like maybe at your local school, maybe at your local library. We're going to figure out your pickup spot on each island. Arsenic samples can sit for a long time. It's not like a bacteria sample. So you can drop off your sample, and when there's enough of them for Doug to pick up or Margaret, bring them on back to us, and we can get them all analyzed. If we feel that's not happening fast enough, we can send them through the mail. And so there's like a video on here, like how do you take your water sample? And I couldn't get the whole screenshot in here, but it tells you how you're going to check your results and keep going in the project. So we have this all figured out for you. So many partners are interested in this and are supporting us, from the Maine Senior College all the way to Island Institute and Maine Seacoast Mission, and so many schools and so many people. I'll leave it there. I'll take you back here because You can always email me directly, but drinking water at MDIBL, that's MDI Biological Lab.org, that email will go to all of us. So I'll get it. Dana, my coordinator, will get it. Morgan Carnes, our island fellow, will get it. So the whole crew, will get your email, and that way the first person who can get to it will get you an answer to your question or guide you to the right place to get started if you're interested in testing your well. So I'll stop sharing right there and answer any questions you have.
Hey, thanks a lot, Jane. So much incredible information. I just want to add that I am working with Morgan and Margaret to figure out how to get Morgan to your island. Our goal is to get Morgan out to all 15 islands so that she can meet with your community, share more about this project, and figure out where on your island you can put your water samples so that we can collect them and get them back to Jane and her team so that they can be tested. As Jane said, this is a long-term study. Morgan will be working with Jane over the next 2 years. So we're hoping to get Morgan out to your islands sometime this fall or winter. So it won't be immediate, but she will get out there. So any questions, you're welcome to unmute and just shout them out.
So Cliff Island represented here, we're looking forward to Morgan coming down. We'd be very interested in having multiple samples from Cliff Island.
Great.
And I'll collect them at the school.
I'm sorry, what?
I'm a teacher and I'll collect them at the school, no problem.
Oh, what school is that?
Cliff Island School.
Cliff Island. We actually have some curriculum. I don't know what all your grades are, but we're thinking about how to integrate some of this in the schools so the students can feel like they've helped out and been a part of it. So we'll talk about that too.
Yeah, it's a K through 5 school.
Yeah, so even if it's just sort of like a community service project where they do something to like keep a list of the samples that came in or anything, right?
We would love that.
Yeah, yeah. Plus, there's probably a little bit of like mapping or a little of the geology that could be interesting even in the lower grades. And we have some really great resources for teachers on that middle button on our website. We've made a lot of what we call story maps, which are like little scrolling presentations that have embedded maps for students to explore and stuff. I think some of those could work well even at the 4th and 5th grade level. So we can talk more about that. But in the chat, I did put the link to our website, all about arsenic.org. Since you're here, we just launched the survey today, like new. And so it would be great if anyone wants to go in and start it and take it and find out what's broken in it. Like, because we've been over it and over it and we find something new every time. So if you want to consider yourselves part of this new day, the drinking water survey used to be at University of New England, and we now have moved it over onto our citizen science data portal, which is called anecdata.org. And immediately after clicking that you want a water test, it'll invite you to register your water sample. And then when your water sample results come back, they'll be right there tied to your survey. So we're trying to streamline the data collection. And so literally we just opened the link today. So I'm sure something's wrong with it, but I invite you to try that out. And, I don't know if any of you have older students, like middle school students or something, but students, 13 and up are allowed to, anyone, of course, could probably set up an account ANIC data, but we recommend children 13 and up. And I think students could be helpful in giving feedback on what does and doesn't work about just the technical process that we've set up.
So we're coming up on 8 o'clock and I want to be respectful of your time. Before we end, any more questions for Jane?
Yeah, this is the town of Long Island, next to Cliff Island. We have a fledgling water study committee that is just got some funding from the town. So we're very interested in participating with this. We have some, I know one of my sons, he has an absolutely astronomical arsenic level in his well, which he's treating. So we certainly have it here. Who has it? Who knows? Because like you say, it has not been part of the regular testing program here. So all good.
Yeah, so interesting. Yeah, I don't think we fully understand the picture out on the islands. So let's do that together. And then we'll tell the state what's missing in their database. Yeah.
Very good. Thank you.
Again, I just want to thank everyone for attending. We really appreciate you taking the time out of your evening. Thank you, Jane, for also giving of your time and for doing this project. We look forward to continue working with you and getting this information out to all of the islands. This is really just getting started. So at least from the island perspective, Jane, I know you've been working on this for a while, but we're really excited to collaborate with you and get this out to the unbridged islands.
Yeah,
Before we end, I just want to remind you again that our next Zoom conversation will be on Thursday, November 9th at 7. And again, the topic is solving medication puzzles with a pharmacist by the name of Elizabeth Sylvia. So hope to see you there. Until then, you're welcome to reach out to me if you have any questions. My email is dkornman@seacoastmission.org. And you can find that on Maine Seacoast Mission's website, so you don't have to remember it. So thank you very much. Great to see all of you and hope to see you in a month.